The quest for improving healthcare among Nigerians has been tied largely to the effective primary healthcare delivery system at the local levels, given that over 70% of Nigerians live in the rural communities. Unfortunately, the near absence of these facilities due to poor infrastructure, personnel and drugs at the rural areas has accounted for the high mortality in the country. Correspondent Gabriel Odia, who files in this report, takes a look at government effort in boosting effective primary health care for rural dwellers.
The primary health care PHC facilities cut across the 36 states of the Federation. Most of them have not lived up to expectations due to neglect by previous administration, as most of the facilities are almost grounded, if not completely, due to poor funding, among others. But with the present federal government's plan to revamp the infrastructures, it is hoped that these health centers will serve its intended purposes. Like in Benue State, where it has 276 PHC facilities across the world at the local government levels.
We need to strengthen our primary health care system with the provision of the appropriate infrastructure and human resources for health needed to make health accessible and affordable to everyone, to cope with the ever-increasing needs of our large population.
Each ward has one primary health care facility that the federal government is supporting. The new administration is working towards that to be able to rekindle the infrastructure. Right now we have a dearth in healthcare workers because most have retired, some are dead. And recall that the Benue State has not recruited healthcare workers over 10 years. We really are waiting earnestly for the governor to lift out that ban.
While the federal government is making efforts to rekindle the primary health care through the Basic Healthcare Provision Fund across the local government levels, states like Benue has planned to provide clinical doctors through a bond scheme to support PHC facilities in the state, given its challenges.
Clinical medical students of Benue State extraction will be paid a certain sum of money while in the clinical years, 400, 500 and 600 levels. After your NYC, you come back and serve upon for 2 years. Believe by the time these young doctors come back from their NYC, our primary care too will have doctors to man those places and will have the services.
What you have is not enough. I told you that most of the facilities are grounded, but the federal government has rekindled our own efforts by saying 1 PHC per ward. So we have 276 basic healthcare provision funds that are across the local government level. So it's not just enough. The federal government said they are going to increase that number across. So we are hoping by the time they do that kind of division, we shall also benefit from that angle too.
A local health provider who lamented death of medical personnel, drugs and basic infrastructure at the primary healthcare center called for government intervention to enable the local populace access these facilities instead of traveling to urban centers for minor ailments.
Where quality healthcare services are lacking, the mortality rate is going to be very high. And that is exactly what is happening in our rural areas, where there's high rate of mortality rates. But if government provides the needed drugs and manpower that is lacking in those rural areas, I think the rural dwellers will have access to healthcare services, and that will reduce the high rate of mortality.
According to the Executive Secretary, State Primary Healthcare Board, some of the facilities only have 2 community health workers, as the board is doing its best to offer quality services while it continues to serve over 14,000 people currently ravished by insecurity.